Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. We help general and pediatric dentists do amazing clinical ortho. And today's question was a by request from a doctor, but also a lit review. So I like to make sure that I give you evidence-based orthodontics answers, and I've been trying to move in that direction. I know a lot of my previous videos have just been like my opinion, which I try, but if I can now find evidence to support what I say, or what I've, support what my training has taught me and what I'm going to teach you, I think it's better. So here's the scenario. Some doctor reached out to me, and I tell you guys, if I don't have your answer, and I feel like I need to give a better answer than I can give, just 1 or 2 sentences, I'll make you a video if it's relevant to my channel. So doctor was saying that he had a patient that had a traumatized anterior primary tooth. Patient was like 3, I think, pretty young. So, obviously with the patient, it really depends on when you have trauma to a front tooth. If you're a pediatric dentist, a lot of it depends on the age of the patient. Should we restore it or should we pull it, right? So obviously to me, I've always been told the younger the patient is, the more we want to possibly restore it, because we want the bone to hang in there. We don't want to deal with a traumatic surgery. But also, if a tooth has been traumatized and it's necrotic and it's leaking bacteria potentially to the healthy teeth around it, that's not a good thing either, right? So a 3-year-old is really different than a 6 or 7-year-old. And I know my own personal story is my daughter had a traumatized anterior tooth, primary tooth, girl versus doorknob, did get necrotic. She was 5, but she was a young 5 tooth-wise. And my husband and I both are dentists, one orthodontist, one GP. He does not do pedo. We traveled a lot, and we were just really worried that, the tooth was going to blow up or damage the other teeth. So we thought it was better to pull in that circumstance. And it looked terrible, and it was definitely affecting her self-esteem, And we thought it was better to pull because we felt we could manage any orthodontic challenges that came up. We were very strong in that category, whereas we were weak in pedo complications or surgical. If something hit last minute, he didn't do any of that kind of stuff. So that was our choice. Whereas this doctor had a 3-year-old, felt pretty strong in the surgical stuff, and the restorative. So it's a completely different scenario. But yes, the short answer is, if the younger you pull, the more likely there's going to be orthodontic complications. So my best answer is we don't know, but if you pull, just be prepared. You most likely will need a phase 1 and a phase 2. There's always a chance that there could be some type of bone anomaly in that area. It might cause issues with impactions future. It could, like in my daughter's case, it really complicate things. And I don't know how much was just also bad luck with genetics, but everything was on that side. So I have to really think it was either from the trauma itself, from the extraction. I don't know whether, if we had restored it and left it in, if these same issues would have occurred. I don't know. It could have just been from the initial trauma. It could have been for the trauma from the surgery. So, yeah, that's pretty much my tip. If you pull young, be prepared for a lot of ortho, and it could really add to your ortho bill, significantly. But if you keep it in and you restore, you have to monitor. That's going to cost money, and it could still be necrotic and damage the other teeth. So either way, there's a risk. All right, thanks so much.